Okay, I'm not a lawyer, but a lot has happened over the last few days of the Take Care of Maya trial, and I'm going to fill you in. Before I get into it, let me say that this trial is very challenging to watch. There are a ton of objections. The lawyers are all over the place.
Is this in evidence?
You moved it in. I thought they moved it in today.
Is this in evidence?
You put it in evidence this morning, sir.
Which one?
That's a double page.
Let me see.
The clerk says this one's in evidence.
And even the judge seems a bit annoyed with everything going on.
Let's talk scheduling for just a moment.
Well, I have a motion, Your Honor.
Let's talk. What's your motion?
So bear with me as I try to give a decent recap about the last couple of days. Let's start with this guy. His name is Dr. Chopra, and he is a well-trained and well-respected doctor for patients with medically complex conditions like CRPS. In January of 2017, before Maya was released from the hospital, but after Beata had passed, he was called in to give his opinion as to what was going on with her. He evaluated her and confirmed her CRPS condition, and his evaluation actually aided in Maya's eventual release from the hospital. A little context behind this next clip is that before Maya was admitted into the hospital, she was on her ketamine treatments kind of regularly and doing pretty decently. But in this next clip, Dr. Chopra is going to speak about the damage Johns Hopkins All Children's Hospital caused to Maya because they interrupted her treatments.
So, it's like any other wound. The wound, let's say I have a nasty wound on my hand and it eventually heals and closes up. But then if while it's closing up, while it's healing up, I go and, hit it again. It opens up, the whole process again starts to heal up, and then I hit it again, and then it starts to, and that's exactly what happens in the cells getting inflamed and the nerves getting inflamed, goes back to it.
Also, here's a clip of him speaking about ketamine, like overall.
Ketamine is probably the safest drug that you can use under any circumstances. So, as we speak right now, first responders all have ketamine with them. When they have a patient with an acute injury, or when they have a patient with asthma, it works on asthma. A patient with severe asthma, all they do is they shoot some ketamine and it improves. They shoot some ketamine and the fracture site can be stabilized. It helps their pain. If they're bleeding out, it helps with shock.
Okay, so what's been established so far is that Maya has had good days and bad. She's had relapses from time to time, including a pretty significant relapse that took place in November 2020 that required her to be on a feeding tube. So his testimony is more about the impact All Children's Hospital has done to Maya and her illness because of her stay. The next testimony I want to tell you about was from Jack Kowalski, who is, of course, Maya's dad. At the beginning, Jack spoke about his relationship with Beata, about her being a nurse, and how thorough she was with trying to get care for Maya and her illness. He also spoke about how Johns Hopkins All Children's Hospital installed a port into Maya, and pay attention to what the diagnosis was when it was installed. This was after Mexico, but before she was admitted and subsequently sheltered there.
Did Maya have a port installed?
She did.
Who installed it?
It was at Johns Hopkins.
Is reflex sympathetic dystrophy, as you explained, the same thing as a diagnosis of CRPS?
CRPS, correct.
And from the best of your knowledge, going in and coming out of this port placement, was the diagnosis reflex sympathetic dystrophy, otherwise known as CRPS?
Same objection.
Are they the same? Yes, they are the same.
At this point in Jack's testimony, he starts to get into what led to Maya being admitted to the hospital in October. He says that day she was in extreme pain and actually had a ketamine infusion appointment scheduled with her regular doctor for the following day. So he and Beata's hope is just to go into Johns Hopkins to get her enough help that would last her until she had to go for her scheduled appointment the following day for ketamine.
Was it your intention to stay there, or did you want to leave?
We wanted to leave. We wanted to go and get her treatment.
Were they telling you anything about the reasons why you shouldn't leave?
Again, object to the.
I believe that their justification was weaning off.
Weaning Maya off of what?
I don't know if it was the ketamine or whatever, but
And John Hopkins actually gave her some ketamine when they got there.
they continued with ketamine. I don't know the exact dosage, but they did treat her with some ketamine.
After those treatments, Jack says he and Beata wanted to leave, but according to him, the hospital didn't want them to leave.
Why didn't you just get up and go?
We were told if we left, we would be arrested.
Okay, now before I tell you about the rest of Jack Kowalski's testimony, I'm going to tell you about why there was almost a call for a mistrial today during Jack's testimony.
We're down to the question of, is there a mistrial motion or not?
Well, I can't make that call until I have a moment to talk to my client, obviously. We weren't sure of the court's ruling.
Come back for part 2. I'm going to tell you about the mistrial and tell you about the rest of Jack's testimony that you want to hear.